Hey, Dr. Shakib here from Irvine Spine and Wellness Center. I am here with my buddy here, John Dickinson. Hey, John.
Hi, how's everybody doing?
We're all doing great. And I would like to take this moment while we're waiting for everyone else to come on board for John to introduce himself. And I'm really stoked about having John because he's not only a professional athlete, now he trains other athletes on conditioning and strengthening, as well as, when you play a certain sport or a bunch of sports, you're very much keen to different things, the telltale signs of injuries about to happen. And it's so wonderful to prevent injuries before they happen, obviously. And for me as a chiropractor, my whole goal is to show my patients so they can tell what's going on before they injure themselves. It's very discouraging when it takes time to have to recuperate, and then many times the injury is bad enough that you never go back to that initial phase. Many times, unfortunately, people end up totally skipping that specific sports because of their injuries. So while we're waiting for everyone else to come on board, John, why don't we take the time here so you can introduce yourself and brag about yourself.
Okay, well, first I want to say thank you for having me on.
It's my honor.
I've never done anything like this, but it's pretty cool.
Good.
So I just completed my 4 years at UCI as a thrower on the track team. I did the shot put event and the hammer throw. And yeah, what you were alluding to earlier about how people kind of wait until they're already hurt or kind of already past that threshold of, okay, now I'm in pain, now I want to do something about it. That's kind of, I was talking to one of my coaches earlier, like being a little more proactive, being more reactive than proactive. It's something we need to switch. And there's things we can look for within ourselves that may not hurt or may not think something's wrong, but just maybe a little weird that you might want to keep an eye out for, that I'd like to address. That I know that leading up to my back injury, I would look at certain things where that looks kind of weird and that maybe shouldn't be like that, but because I didn't hurt, I didn't really think much of it. And so
yeah, and I've noticed a lot of times people use their pain as their gauge of how well they're doing. As a chiropractor whose specialty is actually movement, my specialty is brain-based neurology and posture, and I treat a lot of people who are active. I can so comfortably tell you that if the function and movement is being lacked, it's just a matter of when the injury happens. So the way I'd like for you to look at this interview is looking at your car. I remember in college I took an auto mechanic class, not because I wanted to be a mechanic, but I wanted to be able to tell, at least from the different noises I could hear from my car, or when I would communicate to a mechanic about my car, which I knew nothing about, at least I was not clueless. I could kind of understand, and obviously my goal was prevention. So look at this specific session as a session where John will share with us his experience as an athlete and when he injured himself, the things that he probably wished he knew as they occurred. And then we will break down the different body parts as a subject, not as a physicality, in future interviews that I'll be having with John, where we will specifically hone down on the specific area. So you have that available. I will make sure that this is available on YouTube as well as my Facebook, and obviously John can share that with his group as well. Mm-hmm. So John, can you start by giving us a little bit of a background as to what sport were you, or sports were you playing when, just give us an overview. You used to, I know, shot put and discus, and then some injury occurred and that pretty much bummed you out.
Yeah, so I did the shot put and the hammer. Shot put, there's two ways to do it. You can either do the rotational throw or what we call the glide. The rotational throw, as it's named, you kind of spin around in a circle and you're kind of biasing one way if you're a right-handed thrower or a left-handed thrower. And so my theory is that biasing of so for instance, I myself am a right-handed thrower. So I always rotate over my left leg going into the middle. And so I'm always rotating left, left, left. Doing
repetition.
Exactly. And that's the name of the game for throwing, it's all about reps. How many reps with what weight, you're chasing variables, but at the end of the day, you're either doing drills or you're throwing, and that's every day, that's daily. But hammer is where I feel like it could become an issue because shot put, you're a little more centralized to your midline, but hammer, the hammer, you have a wire and then a hammer at the end of it.
Oh yeah, we both know.
Bridget, yeah. So I wouldn't say it's inherently more dangerous than shot put, but I'd say there's a little less room for error while going through the throw, where you could, potentially put a little undue stress on some of the structures in your low back. With that being said, that's why, you should, if you have a coach, to tell you, how to properly throw and stuff like that.
And obviously, as someone who's actually treated a hammer thrower, I can tell you that with many sports, there has to be a very strong asymmetry because one side of your body is performing different than the other side. So the training of you, I don't know anything about how discus is played, but when I consult a coach as someone who sees an athlete, then I can see how we need to condition right side versus the left side. And the whole point here is, in those instances, the axial line, the midline, has to become solid because everything rotates around it or perhaps shifts sideways around it, depending on this type of sports. So establishing a midline as a strong core is important. Now, I don't want to make this about an interview about me or what I do, but I find the whole definition of core strengthening extremely wide range and extremely wrong. So I just want to make sure that people who are hearing this are not looking at core strengthening as, oh, I'm going to build my ab. So John, during your experiences playing different sports, and you did play, why don't you name the sports that you played?
In college I only did track and field, hammer and shot put, but in high school I did 3 sports. I did basketball and I played football as well.
So you definitely played a lot of sports.
Yeah, I've done a lot of sports. Which I feel like is very beneficial.
Oh, absolutely. Yeah. I'm sure that it allows you to really connect with different types of athletes.
Yeah.
So with your specific injury, it was a lower back injury.
It was my
right?
lower back, yes.
So should we start talking about the lower back specifically and then go south, go to the feet, and then go up?
Yeah, sure, yeah.
So why don't we, what were some of the things that you noticed? So, perhaps if it can be generalized to not just discus, shot put, hammer, but generalized to overall different sports.
Yeah.
And different, by the way, not everyone needs to be an athlete. You could be active. I see more injuries from people, really best intentions, going to the gym, working out, and really jack themselves up.
So definitely. So when I hurt my back, I was actually stretching. I was kind of actually
You hurt your back stretching.
I was
so
stretching,
there.
but the thing is, so I had seen or kind of noticed things about a month or a month and a half leading up to that injury. So starting with my low back, obviously I had some mild discomfort and pain in my low back, and it wasn't necessarily pain in the sense of it hurts. It was pain in the sense of it doesn't feel stable, as if when I would go to squat or when I would go to do any heavy loaded movement, really, it would just feel like it was moving, almost in a sense, like it wasn't like I wasn't solid, in the muscles of my low back and my.
So
my
are you talking about the small of your back? Are you talking about where your upper back ends at L5S1?
Yeah, exactly. So
L5S1, for those of you who don't know, it's this area where your torso ends and your pelvis starts.
Yeah.
Which is, it needs to be solid.
Yeah.
It's very easy to herniate and hurt it.
Yeah, so whenever I'd go into a heavy squat, it wouldn't necessarily induce pain, but I would feel mobility. I would feel kind of just a lack of stability within mostly in my hips, and it would make me think. And back then I was like, maybe I just need to do X exercise or something. I didn't really think too much of it. I just thought like, hey, I'll just throw on a belt even tighter. That ought to give me a little more stability in my hips. Which don't do that. That was dumb. So yeah, it's one thing I saw. And then another thing is when I would, so I would walk and I would feel like I was running, like walking on a runway, like how a runway model walks, how your hips kind of go up and down.
So it wasn't flowing like that. It was kind of wobbling side to side.
Yeah, it was shifting side to side. And
which is not a proper biomechanics, not proper movement. So obviously it's some kind of a guarding that your body is doing. One thing that I want to throw in here, not everything that you do causes pain. If you think about it, cancer, I mean, by the time it becomes painful, it's done quite a bit of damage.
Exactly.
There are most conditions don't cause pain, and the pain is just a signal to say, hey, thumbs up. Not necessarily for everything, but for musculoskeletal conditions that we're talking about, that will come and then it will go away. Its purpose is to say to you, pay attention, thumbs up, look into this. It's not, oh, well, it went away, so everything's honky-dory.
Mm-hmm.
And the other thing is that your brain is dedicated to do what you want it to do. So if you want to play a sport, it's going to play that sport for you at any cost. Any cost means potential injuries. So you notice that, and that's good observation because most people don't see that.
Yeah. So no, and it, like I said, it did not necessarily hurt, but I just realized that I was doing it, and I didn't quite make the link as that this was contributing or a result of my back. I just thought, that's kind of weird. I probably shouldn't be doing that. And so, that kind of goes along with the line of anterior pelvic tilt, that if you don't have a strong core and like Dr. Shkeep said, your entire core, not just your stomach, your pelvis is going to anteriorly rotate, which is going to put some undue stress on the structures in your low back as well.
So anterior rotation is this, kind of like sticking your buns out.
Yes.
That's forward flexion, or basically extension of the lower back is what it boils down
to. So I definitely felt that as well. That was another thing, but I thought that because people said, man, it's just everybody has it, like it's not, it's because it's so common, maybe, I have it too, like, no cause for alarm. So I kind of brushed that signal off as well. But the next signal that I got that I thought was like the last straw that was really weird was when I looked down at my feet, I could see the top of one foot and I saw the side of the other foot. And so when I would walk, I was almost walking crooked. And I knew that obviously should not be happening. And it was at that point, when I was at that point, I knew that something was definitely wrong.
So what did you do about it? How long after this? Well, let's ask you this. How long after the lower back anterior tilt and instability did you notice the foot, the gait malfunction?
So that, I'd say the lower back was first, and then maybe approximately a week or two after I noticed my hips moving when I walked. And then the last was about maybe another 2 or 3 weeks later. When I looked down, I realized I was walking asymmetrically, mostly. And then when I took off my shoes, I realized like my left foot was flat and my right foot was on my arch.
One thing that I think, you don't need to be a podiatrist nor a chiropractor, but it's a great idea to assess the bottom of your shoes on a regular basis. Regular is not daily, but definitely weekly, especially if you're a high-performing athlete or you do a lot of activities, because, you don't have to be an athlete to have back and other issues to begin with. Look at the bottom of your feet, your shoes. If they're not wearing out evenly, there is a problem.
Yes.
It's just,
yes.
That's a telltale sign.
Yes.
There is a problem. So the problem isn't making a decision, hey, I'm going to start walking at 5% of your posture is a decision you make. 95% is the decision your brain has to make in order for everything to go forward and for the brain to give you what you're asking for. So don't be I need to be polite. Don't be ignorant.
Yeah.
And pay attention to this. Paying attention to it means look into it. Well, why did it go out to begin with?
Yeah.
Or why is it bringing out more on one side than the other to begin with? This is all extremely important. Pay close attention. This does not go for just the type of athletes that, you're on your feet. For example, a climber. A malformation or malfunction in the extremities in the shoulder joint will impact your mid back, lower back, and as a result the way you walk. So no matter what you do, what kind of activity, how, if you're a professional athlete, if you just go to a gym to work out, look into it. It doesn't cost you anything. Pay close attention.
Yeah, and so on that note, I feel like we've kind of almost made it seem that like we're trying to say activity is bad or something. We don't. That's not the
health is in movement.
We want to promote movement, but anything you do, in excess. So, for example, throwing, like we're throwing multiple repetitions of the same movement pattern per day, you're going to create some imbalances, and you're going to create some compensations for some weaknesses you may have. And so it is smart to know, like, okay, so I'm throwing every day. I'm always biasing one range of motion and one angle of rotation. That maybe I should, address that and find some ways to fix it. And along the lines of being 95% passive with your posture. Your posture isn't. I mean, I feel like a lot of us think about, chest up, straight back, which is, a big part of posture. But like we said, like the way we stand is a big part of our posture as well. And it being so passive, you can't be passive in, changing that. If your posture passively is to be, rounded over, slunched over, you can't be passive about correcting it. You have to. You can't just lay on a foam roller. You can't just. I mean, nothing against foam rolling. If you're going to do that, you have to do it actively. You have to have a purpose with what you're doing. You can't
and strategically.
Exactly.
Strategically, for instance, for pretty much every athlete, I think if I were to pick one area that no matter what kind of sport you have, you should absolutely do a foam roller. And foam roller, let me just finish this sentence and I'll tell you, I think the IT band. IT band gets involved in everything you do. So foam rolling the IT band is so crucial. And foam rolling I don't know how you do the foam rolling. The way I recommend it to my patients, and it works like freaking magic, is you just go up and down your IT band, and you kind of scan the area. You find the area where it's extra sore. You stop there, and you basically bend your knee and straighten it. It's a great exercise. I actually did a video on that on my YouTube channel. So if you guys don't understand what I'm talking about, go to YouTube, do Irvine Spinal Wellness Center, and then just type in under search in my channel. I think I've called it IT band. Just search that and see what shows up. But it's there. So the key is not to just roll it up and down, but to actually function, have the movement as you're doing it. So you're aware of that too.
Yeah, that
is an amazing thing.
One big thing I changed, just to find that, like a lot of athletic trainers told me to find that hot spot and then dig into it, which is it can work, but to really make a change and to make a change that's long lasting, so you don't have to just foam roll all the time. You got to find that place and then move through that range of motion where you want to make a change in. But
And just remember this: health comes in movement. So even when it comes to stretching, when it comes to foam rolling, when it comes to even massage, I mean, I like massage. There's a value to it, but functional versus static makes a huge difference. If you actively, meaning yourself, go through a range of motion as pressure is being applied, you get a lot more miles out of your workout and your treatment than if it's just direct pressure, no movement. Wouldn't you say?
No, definitely. Just like for example, a couch stretch for your hip flexors. I mean, that will make some changes, but won't be as long lasting as if you're getting to a lunge and then get some external and internal rotation into your hips. And then if you actively put yourself in that position, your brain's like, oh, this is a new range of motion that we need to get accustomed to and probably get used to.
Absolutely. So now that so it sounds like from your observation with your own injury, you noticed instead of going flowing with your forward movement, you're kind of rocking side to side.
Side to side and up and down.
Up and down. Yes. So it's like.
It was, yeah, exactly. It was just the
I'm not vertebra.
of not being stable. I just was not stable at all. I thought in my head initially, I thought,
where the heck have you should have called me.
I know. But the thing, I was in the same boat where I'm not hurting. Nothing hurts, but maybe I should look into this down the line. When it hurts or when I'm hurt, and so, But along the lines of my feet, when I started thinking about my feet and like, okay, that definitely shouldn't be right. I should be pretty even walking both sides. I realized that that kind of contributed to one of my hips being higher than my other, and so my pelvis was also shifted as well. When I tell you I was all messed up, I was really messed up.
So obviously, I have a feeling that you noticed the feet after, but I have a feeling that it might have not been necessarily occurring after the lower back injury. If I were to pick which one, I would pick that over the lower back.
Yeah.
Now, as you, what were some of the other things that you noticed? Did you notice any issues in the knees?
So, being a thrower, we kind of go through heavy compound lifts and squats and stuff like that nature a lot, and so I usually have some kind of discomfort in my knees, but I didn't notice it in any different place, and I didn't notice the degree of which my knees being more or less painful than before or after my back. I'm not sure if that's just because I didn't notice it or because it wasn't as much of a factor as my hips and my feet.
Now, one thing I want to take advantage of the opportunity right now to tell you, listen carefully. I've been in practice over 20 years. I know what I'm talking about. Arthritis has nothing to do with aging. It has everything to do with alignment. So as John's telling me about the foot and lower back thing, I would not be surprised if I were to take an x-ray of John's knee and see arthritic changes in the knee, even though he never had pain. So arthritis is not an aging issue. It's a misalignment issue. If you think about it, you have a door hanging in a frame on a hinge. It could be 6 months old, but if it's sitting on the hinge, crooked, every time you open and close it, it's going to wear and tear the edges. Mm-hmm. Now, it could be a 100-year-old door, but if it's sitting there nice and even, it may look like an aged door. That would be the wrinkles. But it would not have the wear and tear because it's sitting right there correctly. Mm-hmm. So as an active individual, forget about being an athlete, as an active individual, if you have that misalignment, it's just a matter of time before you're going to have the issues with arthritis. And that's really a damage that's done. Yeah. So the goal is not to make it go away because it will not go away. It can only get worse. So then your goal shifts from making it go away to making it not progress. So I am almost positive if was it the right foot that was laterally everted?
My right foot was everted and my left foot was flat. So
So you were opposite.
Yes, exactly.
So your center of gravity, in other words, was shifted to the right.
Yes.
So if I'm just biomechanically just going with what you're saying. So if you're shifted to the right, that means the torso is going to have to go to the left. So I would suspect issues on the left side here and the right side here.
Yeah.
And then a lot of times people think, oh well, I'm right-handed. That's why I have more tension here. Well, that adds, now you've got two components going against you. Then in your case, if you're doing the shot put, that's a load on a structure that is no longer stable. So do you see that?
Yeah, I definitely agree. That's why, every squat, usually I love squats. Like I love squatting. I love doing everything of that sort.
It's a great exercise.
Yeah, exactly. But
if it's done right.
Exactly. It's a high risk, high reward exercise. And if you're out of position even a little bit, it could be, pretty detrimental to your performance. I love squats. The first 3 years, I couldn't get enough squats. The last year, leading up to my injury, every time I squat, like I said, I would think, like, man, that something didn't feel right. It just didn't feel, as strong as it could have been. And so I think that's one thing that's another thing that you can look out for. If you say you have, like, maybe not squats. For me, it was squats. For you, it could be I don't know, another lift or another movement that you repeatedly do for your sport or your movement, if something feels wrong or something feels off, you know, that's not just you. It's not something worth ignoring. You can always just come, you know, reach out to Dr. Shakib, you know, or someone around you just to get an opinion or just to, you know, try and figure out what exactly it is. I mean, if it's nothing, then no harm, no foul. You know?
Well, I really feel that your intuition, the gut feeling, it really has a purpose, and that's one of the tools you're born with for a heads up and for your safety. So don't disregard anything that happens and the way your body communicates. The whole goal here is for you to understand the language the body communicates to you. I mean, if it's in a language you don't understand, well, then you don't understand it. But we're not having you go speak a different language or learn a different language. We're just trying to get you understand the different things and the different ways the body communicates to you. And you need to be, at the end of the day, you need to be aware that when you're working out, this is a work. This is not like listening to your music. This is not, I'm totally, my instruction to my patients is don't listen to music when you're working out. Pay close attention to your posture. Know what areas you're working on.
Yeah, definitely.
I mean, if you're doing your biceps and as you're paying attention, because you're not chit-chatting with the guy next to you, you're not listening to music, you're really tuning in, and all of a sudden you notice you're doing you're doing this or you're doing that, that means your biceps is no longer doing the task. You're mechanically performing, but it's not utilizing the right muscle. That's when injury happens.
Exactly, and I think it's worth
Right on.
it's worth mentioning that when you're doing this, you know, it's so crucial on having so just like the difference between mobility and flexibility, you know, someone could drop into a squat and have high amount of flexibility, but if they can't control that range of motion dropping into the squat, you know, they're opening themselves up to injury. It's no different with, I mean, your spine. I mean, it's meant to move, but to a lower degree of everything else. So you're not supposed to be able to, you know, turn all the way around. There's some degree of movement that I believe that the spine should have, but it should be much less than, you know, everything else. And so what we want to do, our aim is to, you know, if we get into that range of motion that maybe we haven't mastered, or just like the flexibility that we haven't conquered or don't have that much strength in, you know, that's when we can open ourselves up to injury. So maybe using different rotational tools to strengthen those ranges of motion, I feel like can be very beneficial.
Absolutely. When it comes to brain-based neurology and posture, I mean, the way that you assure injury prevention and better performance is when the part of the brain that actually is in charge of that specific movement, because your motor cortex, which is in charge of your movement in your body, has to be properly activated. So like I said, if you go mechanically through a movement, you may not be necessarily using the right parts of your brain or the right parts of your body to perform the task. So proper activation, I think, in those instances, if you notice that the movement is not the way it needs to be, you don't know what it needs to be, but you know it's off. That's all. Look into it, and proper activation of the brain, which is simple exercise you can do at home. It's really nothing. It's pretty simple. With engaging the right muscle, and that's probably what you do with your athletes,
exactly,
right?
Yeah. So a lot of working with athletes, they have a lot of compensation patterns. So maybe if you're supposed to, you know, use your bicep when you're curling and you keep, you know, shrugging, you know, that's a faulty movement pattern.
That's a pathological pattern.
Exactly. And so a lot of you know, high level athletes have a lot of compensation patterns. That's why they can perform at a high level, is because they don't break down at the sign of, you know, injury or sign of a faulty movement. And so a lot of
their tolerance is higher.
Exactly. So a lot of moving is figuring out how the body should move and then how they are moving, and then find the difference and how you can fix that.
So from your experience, what is the first line of approach that you have, other than bringing to their attention, hey, this pattern of movement that you're having is pathological, and this is the biological pattern, meaning the proper pattern, then bringing their awareness to what it needs to be? How do you help your athletes with that?
So usually there's with working with each different sports, I'm very blessed because the coaches have given me a lot of tools to use that I work with at UCI. They've told me a lot of different shown me a lot of different correction movements you can use, and then with those, I mean, you can't just take someone out of play and have them do all these correction movements because they need to be able to exert a certain amount of force on their field of play. So just like an athletic trainer wouldn't take them out of one side of injury, you need to find a way to incorporate these different correctional movements into their already established program to help them get onto the right path, and obviously make them aware of what they're doing.
That's very true. Now, in my case, one of the go-to places, no matter what the sport is, no matter what the injury is, I do what's called DNS, dynamic neuromuscular stabilization, which has to do with, believe it or not, with the neurologic pathway and the muscular stability that is needed for movement from the age of pretty much newborn all the way to the time that you start moving. Standing up. So we just do exercises to duplicate those and kind of regain. It's almost like you went down the wrong path, come back to where the right started, and instead of taking this path, we're going to go this path, and this is the training. So that's what I do in my office as the very initial state of correction.
Yes.
And I feel that would, regardless of that, this goes with the office workers, with desk workers, because that's where the pathological pattern has established. We need to break that pattern, go with a biological pattern. Yes. But I'm noticing our time is coming to an end almost, but I'd like to let everyone know that we're going to make this into a series in 2019. So I'm putting you on the spot.
Okay.
But I really like to break down the different body parts. Perhaps we can go with, let's just say, with the ankle. Okay. So the different types of athletes that you see, the different types of pattern that you see commonly repeated. So we can discuss that. And then as a chiropractor who specializes in sports, not necessarily sports, in injuries due to activity, I can put in and interject and give little things here and there. I feel that the whole goal of, at least for me, and I have partnered up with John here, is if we can prevent an injury, then I feel good about myself if I can prevent an injury. And obviously, we're here as resources to you, but really focus on understanding what sport you're playing and not just what the goal is, because I promise you, if you biomechanically, movement-wise, if you perfect yourself or get close to where it needs to be, your performance is going to be enhanced, right?
No, exactly. Yeah.
I mean, when it comes to the Olympics, it's a matter of seconds that you make it to the first or second place. So that will make a difference. And if you go to the factory reset, which is the perfect design of your body, then, I mean, that's a no-brainer. It's not a rocket science. I was saying that to a patient of mine, and she said that never worked with her growing up because her dad is a rocket scientist. So I'm like,
you can't use that one, man.
We'll tag Aaron in this one. But I want to thank you so much, John, for taking the time to come down here, and I'm looking forward to the different events we'll be doing in 2009. I will promise you, if John is available, we'll definitely incorporate at least one interview with John on a monthly basis, whatever works out with us. And we'll make these available, obviously, on our Facebook pages and on my YouTube channel. And obviously, you can refer people to those instances. If you guys have any questions, please don't hesitate. I'm not going to charge you because you asked me a question. I will make sure I put my email address down here in the description box, or when I post this on wherever I post. I am here to answer any questions you guys have. I would love to prevent any injuries and all injuries by every possible means. And thank you so much for watching. And thank you, John, so much for coming here and sharing this.
Yeah, thank you. I just want to say one more thing. So we're talking about all these things that you can possibly do, and the main thing I want to get across is be proactive in your recovery.
Absolutely.
Don't just like, I see a lot of kids come up to me like, hey, like, what do I do for this?
Where's the opioid?
Exactly. How do I quick fix this? And it's like, no, you need to do, if you really want to take an investment in your body, you need to research like what could possibly be wrong, what can I do it? And then I'm not saying don't reach out to somebody, but cross-reference what you've learned with someone else, Dr. Shakib or myself, and then go from there. Be active in what you're doing.
Absolutely. Anyway, thank you so much for watching, and we'll see you next month. Happy holidays.